Thank you. It feels like the people of Sussex keep getting bamboozled by this government. They were stunned this past spring when the Minister of Health stood in this House and declared that Teladoc virtual care did not add 1 minute to Sussex Hospital's ER hours. And just like that, after a few months in use, he killed the pilot project that was getting rave reviews by nurses and patients. These constituents were no longer sitting for hours in the emergency room waiting to see a doctor for non-life-threatening issues, yet this minister said there was no value. It now appears what's good for the goose may not be good for the gander. Shockingly, the minister is now saying the very service that he claims wasn't good enough for Sussex may now be good enough for the hospital in St. Anne-de-Kent to improve ER coverage. Same equipment, same teledocs. How can the minister explain to the people of my riding who feel cheated out of virtual care that was supporting their wellness? Surely their health is important too.
I recognize the Minister of Health.
Madam Speaker, I'm glad to rise on this question. You know, Teladoc, you need to know the prerequisites for Teladoc to help with overnight care. There has to be a doctor in the community that is able to come in. And so we have looked at Teladoc in other communities, such as Grand Manan, which, as you well know, is I would say is a blue riding today, where it's working quite well. The doctors are able to go home at night, sleep at home, and Teladoc helps look after that community, giving 24-hour care. So Teladoc does work with the right prerequisites. In Sussex, Teladoc was helping the doctors that were working during the daytime, help them see more of the level 4 or 5 not-so-acute patients. So yes, it did help alleviate the burden on the doctor that was doing the day shift, but did not help 1 minute with overnight care in the community of Sussex. Thank you.
I recognize the member for Sussex Three Rivers.
Thank you, Madam Speaker. There's also doctors that live in Sussex who would be there in those overnight hours who could support. I know the minister's shaking his head, but I know a couple of them, you know, but anyway, we'll have that conversation later. Horizon Health said it had a plan to return ER hours at night to the Sussex Health Centre by this past summer, and the health minister killed that plan. Therefore, one would think that would mean he had a different plan to restore 24-hour service to the Sussex ER, but it's been crickets. Meanwhile, continue to call an ambulance if something goes terribly wrong so you can be rushed to the St. John Regional. Problem is, any paramedic is going to tell you there is not an ambulance waiting in Sussex for that something terrible to happen after lights go out at the ER at 8:30 p.m. What is the minister's plan? Please, I've been asking for many months. What is his plan to return ER hours to the very busy Sussex Health Centre, or has it been forgotten as you seem to make haste in finding solutions for other parts of the province?
Je reconnais le ministre de la Santé.
Madam Speaker, I'd like to thank the member opposite for recognizing the value and hard work of doctors that live and work in Sussex. And we meet with them, they offer suggestions, and some of the things that we are putting into place is a negotiated contract with our physicians that does look after ER care, perhaps better than we have in the past. So we are doing that. We are trusting our RHAs to continue working very hard to provide 24-hour care in Sussex. This is not something I asked. It's something I have supported in the right community at the right time. And so I'm looking forward to our RHAs providing 24-hour care in Sussex to a community that requires this. Thank you.
Je reconnais la députée de Sussex Three Rivers.
Thank you, Madam Speaker. I'd love to know when Sussex is going to be the right community at the right time. Love to know that. At election time, this government said it would be the answer to the prayers of the people of Sussex, and they would return 24-hour emergency services in record time. Hasn't happened. Then it hauled Teladoc away despite overwhelmingly positive feedback from patients who were so appreciative for this service. And there's one additional election promise that still has constituents waiting as well. In August of 2024, in her promise to create create 30 new collaborative healthcare clinics. Premier Holt said that if elected, Sussex was going to be among the first. It would open by the end of 2025. We've been watching photo ops everywhere else, but nothing for Sussex yet. That deadline comes next month, Madam Speaker. I'm pretty sure I know this answer, but I want to hear it from the Health Minister. Will the people of Sussex at least have its promised new collaborative care clinic by the end of 2025, since they're getting the shaft in so many other areas?
I recognize the Minister of Health.
Mr. Chair, Madam Chair, the member opposite is correct. Sussex is in our list. In fact, Sussex is in a position on our list where they already have a variant of a collaborative care clinic in the Family Medicine New Brunswick Clinic. And so they've been waiting a little bit to see what our new contract looks like with physicians, to see if it's appropriate for them collectively to move into a collaborative care clinic. And so we have been on hold because they have been on hold to see what we are doing better for primary care. We are doing that. The doctors are voting on this this week. And we look for positive results, and then we will share that with the physicians in Sussex so that they will be a collaborative care clinic, as has been promised by our government. Thank you very much.